The Bright Kenya project, in collaboration with the Liverpool School of Tropical Medicine, will help establish local manufacturing capacity for vaccines, monoclonal antibodies, and antivenoms. This will not only reduce dependence on exports, but also strengthen Kenya's role as a regional health hub, creating jobs and ensuring sustainable access to critical medicine. We are also proud of our partnership with universities such as Nottingham, Oxford, and King's College London. These collaborations support training, mentorship, and the development of critical skills to strengthen our medical education and workforce. This is essential to Kenya as we work to expand access to quality care across the country. Kenya is fully committed to achieving universal health coverage, a cornerstone of our Vision 2030 and our health sector strategic plan. Through the bottom-up economic transformation agenda, we are investing in a fully and publicly financed primary health care system, the Emergency Care Fund, and Social Health Insurance Fund that will cover all Kenyans. We have managed to bring into the health insurance space 3 times more people. In fact, more, because we had about 7 million people in health, on health insurance a year ago. We now have 24 million people. In the last 1 year, we have brought on board another almost 14 million people. And just so that you know how transformative it is, every day, 50,000 on average, between 40 and 60,000 Kenyans register themselves on our health platform. And slowly, progressively, many Kenyans are now realizing the importance of being in that platform. And we are confident that we will be able to reduce out-of-pocket expenditure, fundraisings, and many other things that occasionally become part of health delivery because there wasn't a predictable way of making it sustainable. You find families selling their assets, selling their land, selling their livestock, selling their wares because they want to go and pay for somebody in hospital. We want to make that a thing of the past. On making it high quality, my friend Sakaja here will tell you that we are now working with them on how to have equipment in our hospitals and have those equipments in a way that doesn't strain our budgets. That we've now worked with manufacturers for them to deliver equipment, and we pay on a program of pay for service or fee for service, so that we don't have to buy an MRI, for example, or a CT scan for a hospital. A CT scan is available at the hospital, and we pay for as many times as we use it. If for one reason or another it breaks down, it is the responsibility of the manufacturer to repair it. We will wait. We will pay nothing until they repair it, and then we continue using it. So to create that space, and also to make sure that there are health commodities in our hospitals, specifically to make sure that health is of such quality that our citizens deserve. And as a government, we decided that on matters health, we are not going to depend on donors. We are going to be able to make it sustainable. We must build it on locally mobilized resources. And therefore, we decided that we are going to reorganize the funding model for our health infrastructure and health delivery. Today, contrary to what it was before, we decided to make an equitable program, to create equity and to create uniformity, So everybody today in Kenya pays 2.75% of their income. For the vulnerable members of our society, health insurance has come down from 10% to 2.75%. For the rest of us, it's gone up from 0.1% to 2.75% of our incomes. And by so doing, we have created sustainable funding. You know, we can now predict with much more accuracy and clarity how we are going to take care of our health infrastructure. We now have 107,000 community health promoters in Kenya. Their stipend is shared between the national government and the county governments. Governor Sakaja here, the governor of the city of Nairobi, will tell you he has 7,840 community health promoters in Nairobi. Just one county. And it is the infrastructure that supports health at the very bottom of the pyramid. Every community health promoter has a couple of homesteads to think about. And apart from building that solid base and making sure that these promoters are people who have been trained on the very basics of what to look out in communities, especially when we are trying to attend to them on matters health.